Hi, I'm Amanda Martin, orthopedic sports medicine surgeon at Elite Sports Medicine at Orthopedics. Today we're going to talk about ACL injuries, particularly those in the female adolescent athlete. So an ACL tear is an ACL. If you have one, I have one. There are very few number of people who maybe don't have one, but that's a topic for a different day. ACL injuries in women are more frequent. It's something we've known for a very long time, and we're beginning to understand more and more why that may be. So many people have postulated different things. That's a fancy word for saying they've guessed different reasons why girls tear their ACL more than young male athletes. One of the reasons is naturally more mobile joints, so young female athletes tend to be a little bit more flexible. Another reason could be hormonal. Another reason could be size and architecture of their notch. One thing that's been proven time and time again is neuromuscular control. Not that female athletes are weaker, and a lot of times young women hear that and they just sort of zone out and stop listening. The truth is not that they're weaker, it's that they have different neuromuscular control in their dynamics of how they may perform a sport. So one of the most important things that we talk about when we talk about an ACL tear in a young female athlete is something we think of as a dynamic valgus moment. So when a girl jumps and lands, she has a tendency to collapse her knees down in sort of a knock-knee maneuver. That actually places a huge force across the ACL, which is a rotation injury. That particular injury is very common in things like gymnastics, tennis, basketball, soccer, any sport that allows them to cut and change direction quickly. The majority of ACL tears in everybody are non-contact, and the female adolescent athlete is particularly at risk because she has very, very strong quads and perhaps not as balanced hamstring and glute control. That's the fancy word neuromuscular control we're all speaking so much about now. I think that prevention is the most important thing that we can do. There's some really great programs out there, and I particularly am involved in U.S. Soccer, who has been on the forefront of development of ACL prevention programs. The FIFA 11 or the Santa Monica PEP program really took note of the fact that young women seem to be more quad dominant and have less hamstring and glute control. One of the single best things that we can do for athletes is to help balance that neuromuscular control, meaning hamstring strengthening moves, glute strengthening moves, core balance, flexibility, and really trying to take over that quad dominant, large collapse into the knees moment and make it more balanced. It's been highly effective and proven time and time again in research. One of the best programs I can point to is the FIFA 11 program, and that's something that we really try to incorporate into our sports training at Elite and Empower. One thing we try to say is this is not a weakness. You may have rock star quads, hamstrings, and glutes. What we want to do is to help balance them so they fire at the right time and the right way to prevent an ACL injury. These programs are highly effective. If you watch the world's best athletes in soccer warm up, they're incorporating that program. And it's stuff none of us want to do. It's squats, it's planks, it's bridges, it's all of the glute activation exercises. I say it over and over again to my athletes, particularly when we travel internationally. The hips don't lie. If we can get your posterior hips and your glutes working, we're going to help protect your knee. I'm Dr. Amanda Martin with Elite Sports Medicine at Orthopedics. Thanks so much for watching these. If you ever have any questions, reach out to us. You can find us online and in your friendly neighborhood area.